Learning outcomes. At the end of the presentation, students will be able to describe infectious agent, source, reservoir, types of reservoirs, cases, subclinical cases, and latent infections, primary, secondary, and index cases, carriers and classification of carriers, modes of transmission, direct and indirect transmission, and incubation period. Epidemiologic triad. The standard model of infectious disease causation has three columns. Number one, agent, a microbe that causes disease. Number two, host, an organism that harbors disease. Number three, environment, external factors that allows disease transmission. The factors which play important role in host, environment, and agents can be explained as on part of host, age, sex, race, genetic profile, previous diseases, immune status, religion, customs, occupation, marital status, and family background play a role. In case of environment, temperature, humidity, altitude, crowding, housing, and neighborhood has got roles, as well as water, milk, food, radiation, pollution, and noise. In case of agents, there are three main factors: biological, that is bacteria, viruses; chemical, including poison, alcohol, and smoke; in physical, trauma, radiation, fire; and nutritional, which include lack or excess. Dynamics of transmission. Communicable diseases are transmitted from the reservoir source of infection to susceptible host through chain of source of reservoir, mode of transmission, and susceptible host. Source or reservoir. These are natural habitat of infectious agents in which an infectious agent normally lives and multiplies. Examples are human reservoirs, animal reservoirs, in case of zoonotic diseases, and reservoirs in non-living things. Human reservoirs may become cases or carriers. In case of cases, they may be clinical cases, subclinical cases, and latent infection cases. On the other hand, they may be primary case, index case, and secondary case. In case of carriers, they can be further classified as on the basis of type, incubatory, convalescent, and healthy carriers. If we classify them on the basis of duration, then there are two types of carriers, which are temporary and chronic carriers. And if carriers are classified on basis of their total of acids, then they can be said as urinary, intestinal, respiratory, and others. As already described, cases may be primary, index, and secondary. Now, what is a primary case? The first case of an infectious disease introduced into the population is a primary case. An index case is the one that first comes to attention of investigators. And secondary case is the case that develops from primary case. According to spectrum of disease, cases may be clinical, subclinical, or latent. Clinical cases may be mild, severe, typical, or atypical, depending upon the gradient of involvement. Subclinical cases are asymptomatic or mildly infected that does not alert the patient. Latent cases are asymptomatic and they are capable of showing symptoms under some circumstances if they become activated. Carriers. Carriers are infected persons that harbor specific infectious agents in the absence of visible clinical disease and serve as a potential source of infection to others. Carriers are less infectious than cases. They live a normal life but can infect other individuals. Epidemiologically, they are more dangerous as these escape recognition. Carriers can also be classified as incubatory carrier, convalescent carrier, and healthy carrier on the basis of type. Incubatory carrier is the one or the person that is capable of transmitting an infectious agent during incubation period. Convalescent carrier is the person who continues to spread the disease agent during period of convalescence. For example, typhoid fever, cholera, whooping cough. In these clinical recovery does not coincide with bacteriological recovery. Patient becomes symptomatically well, but he continues to shed bacteria through different portals of tests. Healthy carriers. Healthy carrier emerge from subclinical cases. That is, subclinical cases become healthy carriers. Carriers may be on the basis of duration, they can be classified as temporary or chronic carriers. Temporary carriers are those who shed infectious agents for short periods of time. All the three incubatory, convalescent, and healthy are included in temporary carriers. Chronic carriers. The carriers who excrete the infectious agent for indefinite periods, for example, typhoid fever, hepatitis B, dysentery, malaria. Carriers can further be classified on the basis of portal of entry as urinary, intestinal, respiratory, open wounds, and blood. Animal reservoirs. Infectious diseases that are transmissible under natural conditions from vertebrate animals to man, for example, rabies, plague, bovine tuberculosis, etc. Reservoirs in non-living things. Soil and inanimate matter can also act as reservoir of infection. For example, soil may harbor agents that causes tetanus and SARS. Modes of transmission of disease. Communicable diseases transmitted from the reservoir are source of infection to a susceptible host in many ways. Mode of transmission are broadly classified into two types: direct transmission and indirect transmission. Direct transmission further can be classified as direct contact, droplet infection, contact with soil, inoculation into skin or mucosa, transplacental. Indirect transmission. Indirect transmission is through vehicle-borne, vector-borne. Vector-borne may further be mechanical and biological. And if we talk of biological, it can further be propagative, cyclopropagative, and cyclodevelopmental. Fomite-borne, unclean hands and fingers. Microorganisms are sources, reservoirs like humans, animals, food, water, air, and soil harbor different modes of transmission which may be direct or indirect and include intervening agents, vectors, animals, insects, and humans, vehicles, water, sea, air, medical devices, various other inanimate objects to reach the human use. Direct transmission. Direct physical contact is from source or reservoir to a susceptible host. For example, skin-to-skin contact, sexually transmitted diseases, AIDS, eye infection. Droplet infection is through saliva or nasopharyngeal secretion. For example, flu, diphtheria, whooping cough, tuberculosis, meningococcal meningitis. Contact with soil. The disease agents in the soil, for example, bookworm infections, tetanus, mycosis, etc. Inoculation into skin or mucosa. The disease agent inoculated directly into skin or mucosa leading to infection include rabies, hepatitis, and transmission through placenta or from mother to child also come under direct transmission, and it includes toxoplasmosis, rubella, cytomegalovirus, herpes simplex. Indirect transmission, vehicle-borne transmission. The agent multiplies or develops in vehicle and transmits through agencies like water, vegetables, fruits, milk products, ice, blood, serum, tissues, or organ transplantation. For example, diarrhea, typhoid, cholera, polio, hepatitis A, and brucellosis. Vector-borne transmission. Living carriers that transport infectious agents to a susceptible host. It may be mechanical transmission. Mechanical transmission is when simply carries pathogenic organisms on their body, when a vector simply carries pathogenic organisms on their body and transfers them to food, for example, flies and cockroaches. Biological transmission. In biological transmission, the agent multiplies and develops in a vector. It includes propagative transmission, multiplication without cyclic chains such as dengue hemorrhagic fever, yellow fever, etc. Cyclodevelopmental transmission is when there is no multiplication of the agent but cyclic changes occur as in filariasis. Cyclopropagative transmission. Multiplication and change of agents occurs as in malaria in mosquitoes. Airborne transmission. Transmission is carried in air in form of droplets and dust, for example, TB, influenza, chickenpox, measles, viruses, spores of fungi, etc. Fomite. These are inanimate substances other than water or food contaminated by infectious discharge. For example, diphtheria, typhoid, bacilli dysentery, hepatitis A, eye and skin infection. Diseases can be transmitted as horizontal transmission. Horizontal transmission is direct transmission from one individual to another in the same generation. It can be through direct contact like licking, touching, biting, or it may be through indirect contact, for example, cupping, sneezing, through vectors, fomites. Fomites allow the transmission of disease without physical contact. Main forms of transmission are vertical that occurs from mother to child to placenta or during birth or by colostrum or suckle milk. Horizontal transmission is either through direct or indirect means. Susceptible host. The person who is at risk for developing an infectious disease is called susceptible host. Factors making persons susceptible are extreme of ages, young and elderly are at more risk. Underlying chronic diseases such as diabetes or immunosuppression can also lead to susceptibility of infection as in HIV, chemotherapy, and malnutrition. Stages of infectious disease. There are different stages starting from incubation period, prodromal phase, invasive phase, decline phase, and convalescent period. Chain of infection. Chain of infection is a model or a circle of links used to understand the infectious process. Each circle represents a component in the cycle. Each link must be present and in the sequential order for an infection to occur. Breaking any link in the chain can disrupt the infection. Chain of infection. Susceptible host to infectious agent, reservoir, portal of exit, mode of transmission, portal of entry to susceptible host. How we can break the chain to prevent transmission of disease. Diseases have certain weak points. The basic approach in controlling the disease is to identify these weak points and break the weakest links in the chain of transmission. Chain of infection. It is the process that begins when an infectious agent leaves its reservoir or host through a portal of exit and then is conveyed by some mode of transmission to enter through an appropriate portal of entry to infect a susceptible host. Infectious agent. Infectious agent is the pathogen that causes diseases. It can be microorganisms, virus, bacteria, fungi, or proteins. Breaking the chain in case of infectious agents by early diagnosis and treatment, cleaning, disinfection and sterilization, infection prevention policies, and pest control. By application of these measures, we can break the chain of transmission at the point of infection. Reservoir or host. To break the chain at the level of reservoir or host, we have to apply the following principles. Principal habitat where infectious agents live and multiply to destroy, from where they may spread to cause infection. Breaking the chain at the level of reservoir of infection is by cleaning, disinfection, and sterilization. By application of infection prevention policies and by control of pests. Portal of exit. It is the site from where microorganisms leave the host to enter another host to cause infection. For example, upper respiratory tract, saliva, sneeze, cough, gastrointestinal tract, feces, vomit, blood, infected blood, urogenital tract, semen, vaginal secretions, and urine. Skin and mucous membranes include discharges. We can break the chain at the level of portal of exit by hand hygiene, personal protective equipment, control of aerosols and splatters, respiratory etiquette, and waste disposal. Modes of transmission. The route by which an infectious agent is transmitted from a reservoir to another. 6S. 6S in indirect transmission are shoes, flues, fingers, termites, feces, flies. In case of direct transmission, person to person, touching, kissing, sexual intercourse, sucking, sneezing, talking. Transplacental transfer of infectious agents from pregnant women to fetus via placenta. And indirect transmission is by airborne method, by vehicle-borne transmission, and by vector-borne transmission. Breaking the chain at the level of mode of transmission is by hand hygiene, personal protective equipment, food safety, cleaning, disinfection, sterilization, isolation. In case of portal of entry, we can break the chain by hand hygiene, personal protective equipment, personal hygiene, and testing. Susceptible host. Breaking the chain at the level of susceptible host is by immunization, treatment of underlying diseases, and patient education. Incubation period. The time interval between invasion by an infectious agent and appearance of first symptoms of the disease is called incubation period. Importance of incubation period. With the help of incubation period, we can trace the source of infection and contact. We can estimate the period of surveillance if incubation period is long. Incubation period can help in planning immunization process. Identification of point source of propagated epidemics, and it can help in understanding prognosis of the median incubation period. Time required for 50% of the cases to occur following exposure is called latent incubation period. Latent period. Period from disease initiation to disease detection is called latent period. Generation time. Interval of time between receipt of infection by a host and maximal infectivity of the host. Serial interval. The gap in time between the onset of primary case and the secondary case. Communicable period. It is defined as the time during which an infectious agent may be transferred directly or indirectly from an infected person to another person, from an uninfected animal to man, from an infected animal to man, or from an infected person to an animal, including after food. Attack rate. It is the risk of getting the disease during a specified period, such as the duration of an outbreak. A variety of attack rates can be calculated. Overall attack rate is the total number of new cases divided by the total population. Attack rate here is calculated by diseased person divided by the total community, and it is 76% and 64% in the above two information. Secondary attack rate. It is defined as the number of exposed persons developing the disease within the range of incubation period following exposure to the primary case. How diseases can be prevented and how they can be controlled.